Hi all. Here I am going to explain about reversible and irreversible pulpitis. First, we will see about how a dental caries progresses. That is, progression of dental caries to reach pulp and beyond. Here we will see what are the differences between reversible and irreversible pulpitis and what is the importance of differentiating these two. First, we will start with the dental caries and sequelae of dental caries. What happens if dental caries is not treated? Caries starts from enamel, then goes to dentate, then only it reaches the pulp. So the first is enamel caries. When it is deepened, it goes to dentine. It is called as dentinal caries. Then slowly pulp is affected. At that system, that time it is called as reversible pulpitis. And further, when it progresses, it is called as irreversible pulpitis. Irreversible pulpitis can be acute or chronic. Usually, it starts with acute, slowly goes for a chronic stage, and then it may become necrotic. So here, this picture shows how an enamel caries starts. It should be starting from pit and fissures and in a triangular form with a broad base towards the dentino-enamel junction. It goes. But the scenario is different when it is in the proximal region. Proximal region, again, it is a triangle, but its base will be in the surface of the enamel. Then once it reaches the dentino-enamel junction, there is a lateral progress of the dental caries. So more of the enamel is undermined because of the lateral progress of the caries lesion. This is what called as dentinal caries. Then the caries progress towards the pulp. It is again forming a triangular shape, but here the base of the triangle is at the dentino-enamel junction. And when it goes halfway through the dentine, slowly pulp gets hyperemic, a small area of inflamed pulp. And this will be explained by the patient as some sensitivity by having cold foot. And this is what called as reversible pulpitis. And if nothing is done, the caries lesion still progresses further towards the pulp and the entire pulp becomes inflamed. And this inflammation will never become normal. Whatever you do, that inflammation will be inflammation only. And that's why it is termed as irreversible pulpitis. And further, it will lead to a non-vitality of the tooth. And we start with the first step of the pulpal inflammation, that is the reversible pulpitis. The causes are dental caries, recent restorative procedures, quality restoration, trauma, regressive alterations, anything. 90% of time it will be dental caries. And for older adults, it may be regressive alterations. What are the clinical features? The cardinal symptom is mild pain of brief duration after stimulation with heat, cold, or sweet. It is probably most commonly patient will be explained about cold and sometimes with sweet. The pain lasts for less than 10 seconds. That is very important. So these two things you have to get from the patient. It is not what we see. So it comes in the history of the patient, history of the pain. And in differential diagnosis, you have to differentiate it from irreversible pulpitis. The symptoms of irreversible pulpitis is totally different. Investigation, what you can do is electrical or thermal pulp testing, where you can create the sensitivity to the patient and you can find out for how long the pain lasts. And treatment here is indirect pulp capping. That means you have to remove the entire caries lesion, give a pulp protecting base, and then do the restoration. That is called as indirect pulp cap. In irreversible pulpitis, majority of the pulp area is hyperemic. You can never revert the pulp back to normal. So the treatment is root canal treatment. So the question is whether you have to go for a root canal treatment or not is according to our decision or diagnosis. Etiology of irreversible pulpitis, same like reversible pulpitis. Dental caries, restorative material, faulty restorations, trauma, and regressive alterations. And clinical feature, the cardinal symptom is spontaneous pain from the tooth. Without anything, pain starts. It may be at night time. And prolonged pain. The pain lasts for more than 30 seconds, sometimes 30 minutes or more. Pain starts from cold stimulation and sometimes from even heat. And patient cannot locate the tooth because it is a visceral organ. Pulp is a visceral organ. Patient cannot know from where the pain comes. This pain lasts for more than 30 seconds. And these are the pictures of irreversible pulpitis. And differential diagnosis, you have to differentiate from reversible pulpitis. This differentiation is mainly from the patient's history. That is, what causes pain and how long it is there. Investigation, again, you can do the electrical and thermal pulp testing and find out for how long the pain stays. Treatment here, it is not indirect pulp capping. That is a wrong treatment. In irreversible pulpitis, you have to do root canal treatment, or else if grossly destructed tooth, you can do extraction. Irreversible pulpitis may be acute or chronic. The name what we give, that is the physician at the chair side. So if a severe symptom with a lot of pain, severe pain, and which patient cannot tolerate, then we name it as acute. And in case of pulpitis, definitely there will not be any tenderness on percussion. If you tap the tooth, patient may not get pain. In chronicity, all the symptoms reduces. Everything goes for a subnormal. So sometimes pain may be there or some may not be there. If at all pain is there, it can be tolerated by the patient. Sometimes you can see the clinically exposed pulp. And there may be hyperplastic tissue proliferating and filling the caries lesion, which is called as pulp polyp. And next stage is a necrotic pulp, also known as non-vital. It is a symptomless. There will not be any symptoms. But if you ask a history from the patient may tell about an episode of irreversible pulpitis long back, maybe 1 month or 1 year back or beyond. This will not react to electrical or thermal pulp testing. That's how we will identify it from a normal tooth. Normal tooth will react to normally to electric and pulp testing, but non-vital tooth or necrotic tooth will not react. And here the treatment is again extraction or root canal treatment. Thank you.